Carpal tunnel syndrome is painful, and it can result in many employees missing quite a bit of work. Dr. Brandon Luskin of the Palm Beach County Medical Society joins us to answer so many questions that we got about carpal tunnel. We always do. Nice to see you. Thanks for your time today.
Good morning, Roxanne.
How do you get carpal tunnel?
There are a lot of different ways that people get it. Some people it's associated with a medical condition such as osteoarthritis, rheumatoid arthritis, or hypothyroid, other medical conditions. Some people just get it from chronic repetitive activities.
Well, it's funny you don't mention the chronic repetitive activities first, because it always seemed to be associated with using the computer.
There's certainly a higher incidence of carpal tunnel in people who do repetitive activities such as computer, but certainly not limited to that group.
Our viewer question is several questions in one, but we'll answer them one by one, but I'll read the whole question. What are some of the early warning signs that a person may be experiencing the effects of carpal tunnel? What can a person do to prevent it from getting worse? And this person is waking up in the middle of the night with a heat-feeling pain in the top of her hand, but has no bad feelings or no pain in her forearm. Is that carpal tunnel?
It certainly could be. The most common symptoms of carpal tunnel are pain, numbness, and tingling, pain at night, or cramping in the hands at night that awaken people from sleep. Some people just have cramps or burning or numbness in the hands while they're driving or reading during the daytime, or they're dropping things. Those are the most common things that
Would you actually get pain while at the computer?
Certainly, that would be a common symptom.
So all of those things are symptoms. How do you prevent it from getting worse?
Well, the earliest thing to do, I think, is to probably start some bracing. Nighttime or daytime bracing with a wrist support brace can very often help alleviate the symptoms early on in the condition.
What do you go to after that?
Well, my first line treatment after that is going to be a cortisone injection. It's very effective for many people, regardless of the cause of the carpal tunnel, at alleviating the symptoms.
How do you diagnose carpal tunnel syndrome?
Well, the most important thing is history. Most people will have that history of pain, numbness, and tingling, or pain at night that awakens them from sleep. Physical exam, very often if you tap over the nerve at the wrist or hold pressure over the nerve, you can elicit the symptoms. Just between the history and physical exam, that's 90% of the diagnosis.
So it's pretty much a clinical diagnosis. You talk to the patient and feel things and talk about that.
Exactly.
Can you treat it and still maintain an active schedule?
Oh, of course. Most people, the treatment is simple. It might be nighttime splinting or a cortisone injection. 1 in 10 people end up going on to surgery, and even surgery is very less invasive than it had been years ago, and most people can get back to function very quickly.
In fact, somebody talked to me about laser, and I've done actually a story on laser therapy for carpal tunnel, and that seems to have been very effective.
The laser is a modality that the therapists are using for carpal tunnel. There is some efficacy for this. Therapy in general isn't as efficacious, isn't as useful as cortisone, so a lot of doctors don't frequently send for therapy unless they've tried other conservative things and the person is interested.
The final viewer question was about preventing it, and wanted to know, with her kids using the computer, should they each have hand braces, or wrist braces, at the computer to put on when they use the computer, because they use it quite a bit for homework and research?
Most people use computers and never have any symptoms. I wouldn't worry about it until someone's complaining of an issue. It's very helpful to have a support for the wrist, a pad right in front of the computer, right in front of the keyboard, that helps elevate and lift and support the wrist. After that, most of these kids never have problems until later in life, if there's going to be a problem.
Dr. Brandon Luskin, thank you so much for your time today. And the Palm Beach County Medical Society sponsors today's expert and is also the sponsor for today's Ask the Doctor segment. We're back with more in just a moment.